Talking Women's Health. I'm Amy Young, the CEO of ABOG, and we're here today to have a candid conversation with another amazing leader in OBGYN. So I'd like to welcome my guest, Dr. George Macones, and we're going to be talking about the value of research, a really important topic for us. So George is the president of the board of directors for the American Board of OBGYN. He also serves as the chair of women's health for the Dell Medical School and also the executive vice dean at the Dell Medical School. And so we are just really honored to have you here with us today, George.
Great. Amy, thanks for having me. I'm excited to be here.
So, research is a very near and dear topic to you. You have been a very prolific researcher across your career. You have more than 400 published articles. You have been funded by many, many very well-respected funding agencies, including the NICHD. And so, the importance of research in advancing our field is critically important, but it's also critically important for the work we do at the board. So I wanted to start off and talk to you a little bit about research at the board. One of the things that you've done as the chair of the board is that you resurrected the board research committee. So I was wondering if you could talk to us a little bit about why you resurrected that committee and what your hopes and aspirations for that committee are.
Yeah, so good question, Amy. So, so as you said, so research has been sort of fundamental to my career, and research is how we create evidence, and evidence is how we either practice the best as we can as an OBGYN or give the best exams and sort of everything in between. And, I really felt like we were at a place, with your leadership, that we could really begin to harness some of the data that we collect as part of a certifying body. And I'll tell you that, I also sat on the American Board of Family Medicine for 5 years. As a voting board member. There's always an OBGYN on that board. And I really got to see some of what they had done, sort of firsthand research-wise. They've got a huge research operation. And most of it is sort of focused on, I would say, sort of the value of certification, number one. I would say, second, they do a lot of work on sort of the mechanics of certification and trying to optimize their processes, and theirs are different than ours. They don't have an oral exam and the like. And then they also do a lot of work on workforce. And I really sort of took a lot of that to heart and sort of realized that, we could contribute a lot in all of those areas. And it really seemed like the time was right as we sort of have upped our IT infrastructure here. And, you and the team have been very thoughtful about the data that we collect, both for the qualifying exam, the certifying exams, and then for continuing certification. So, we're sitting on data that could really help to inform those three areas that I talked about. So I felt like the time was right to sort of restart the research committee. Interestingly, I was the first chair of the research committee, and I recommended that we close it. This was about 6 years ago because we didn't really have the infrastructure to really get a lot done. So, it's been great. Corey Schreiber from Penn, board member, is sort of the chair of that committee, and I think we're making a lot of progress quickly.
We have the power of the data that we have was really new knowledge for me as I came in as the CEO, and being much more methodical and strategic about how we collect that data, how we catalog and save that data, and then how we make it available not only for the projects that you're talking about, but other people are starting to realize that we have this data. And so I think in the last couple of weeks, we made data accessible to some other researchers. Obviously, this data is de-identified, all with the goal of moving the field forward and helping support the advancement of women's health care. So I really feel like we've seen that evolve over time.
Yeah, and that's great. There are tons of smart people who are really going to be interested in this, around the country. And, I think if people come with a good research question and a solid sort of plan for what they're going to do, I think we should be supporting that, as well as sort of all the work that we're doing internally.
Right. One of the things that I feel like in the last 2.5 years of us working together, is I feel like we've really clarified several really fundamental, important facets of the board. So I think we've always had a great mission, but I think we have a vision that we've been acting on for the last several years. And then last summer, we clarified our values. And there's three of those values that I think really align to this sort of research direction that we're moving in. And those are the values of scientific, which is sort of number one, front and center. But we also have the values of innovation and we have the values of intentional, which I think are really aligned to the conversation that we've been having. How do you think about those values, and how would you explain to our audience how those interact sort of in this research paradigm and where we're going?
Yeah. So, I think our diplomats will be seeing more of the word, especially scientific, as sort of a new logo comes out. But I think science drives innovation. Like that's really how you make progress. And when we're thinking about sort of the science of certification, we want to be giving the best exams we possibly can. The exams that really let us know if someone is a really terrific doctor. And I know one of your main focuses is not just sort of what the lowest bar is, but mastery is as well. And sort of how do we begin to try to measure that? But I think science does drive innovation. And I think the intentionality is also really important because, we talked a little bit about sort of collecting data. We don't want to be collecting data just for the sake of collecting it. We want to be collecting data because we have an idea of what we want to use it for. So it's sort of a circle of being intentional about what you collect and then using a solid scientific process to drive innovation. So it's a circle that we hope is just going to keep, going around and around and around and faster and faster and faster. And again, I think, under your leadership and with everyone here, we're off to a really tremendous start. It's going much, much more quickly than I ever could have dreamt.
We have so many ideas, and there's only so many people, and so this opportunity to really reach out to our diplomats and sort of harness that manpower, I think, to get this important information out will be critical as we move forward.
Yep.
One of the things that the board does that I don't think anybody realizes, I didn't realize until I came in as a CEO, is the grant funding that the board makes available to right now 3 agencies: the RSDP, the AAOGF, and the ABMS Scholars Program. It's a really critical thing that we do for the specialty that I don't think that people understand, and that we've had a long history and heritage for doing. And I think it's a very critical fundamental piece that helps move science together for the specialty. Can you talk to us a little bit about the board's commitment in that area, why this came about, and how you see that going in the future?
Yeah. So, so I've been around the board for a long time. And I remember that we were supporting RSDP and AAOGF back when Norm Gant was the executive director.
Mm-hmm.
And then Larry Gilstrap, it continued with Larry. And then with George Wendell, continued there, and we're continuing it now. And I think, even back in Norm's time, there was a recognition that research on women's health was woefully underfunded. Even if you look at NICHD, I think it's something like 75 to 80% of grant dollars go to pediatrics and not to women's. Not that pediatrics isn't incredibly important, but so are women. And, I think that sort of led Norm and Larry and George and you and I and others to realize that there need to be places that are helping to fund the next generation of scientists who are going to be, leading us, being mentors, being department chairs maybe, and really helping to lead the field. So that's really sort of how it started. And I would say it's even more important today. I'm sure many of our diplomats sort of at least have read the executive summary of the National Academy of Medicine report on research in women's health, which essentially says the same thing, that we are woefully underfunded. And it's not just pregnancy, it's everything. And we have a lot of work to do. And I think that I'm really proud of the fact that the boards has been supporting AAOGF and RSDP specifically. I think we like those because those programs fund all sorts of different kinds of OB/GYN scientists. You could be a specialist, you could be a GYN oncologist, you could be an infertility doc, you could be anything and be funded by those programs. So it's not like it's something just for oncologists or just for infertility specialists, subspecialists. So those have been very attractive, and we get to, see reports about what the scholars are doing. Some of them have, had incredible careers, and it's great to see some great young people coming up. So, but I'm really proud of that. That's something that the board has done for a long time, and I hope we keep doing it, and I'm sure we will.
It's great. You know what? It's been really interesting. I've been able to attend some of the retreats for those meetings. And it's not only the environment that's created by those groups. It's not just that somebody does MFM research and somebody does REI research or GenOnc research. It's also the interplay of the subspecialties together and the specialty together in that room talking about their research. They learn technologies and modalities from each other that they can then go and apply to their work. And really the collaborative spirit of what they're doing, to me, is some of the best work that we can do to put the specialty forward.
Yeah, and I think that interdisciplinary nature of research is sort of where we're headed. So bringing people together like that is fantastic. Amy, I did want to mention the ABMS Scholars Program that you brought up. So that's something new that we decided to move forward with, I guess now almost 2 years ago.
2 years ago.
Yeah, and it's, that Scholars Program we've named on behalf of George Wendell, who is, your predecessor. And we thought it was a very apt thing to do for George because he was a person that really helped us to understand the importance of ABMS to ABOG and to medicine, to the House of Medicine in general. And that is really bringing in sort of a younger person who's interested in doing research in the things that are really important to the board, like workforce, value of certification. And again, I think we heard a presentation last year from our first ABMS scholar, and it was terrific. So I think it's going to be, a way to get somebody young engaged in what we do and the process, and hopefully this becomes something that they make part of their career.
That scholarship specifically funds really tangentially sometimes related educational research, and that is very difficult research to get funded, and that's why we tend to kind of lag in that space. And so it's really a step forward from my perspective for the board.
Yeah.
Just kind of along those same lines, we've got this difficulty in funding, but what I've learned from some of the data that we have is that, especially in the area of our subspecialty divisions and our subspecialists across the country, research is an integral part of what they do. And so we've gone through a sort of a series of surveys where we asked first the leaders in the field, how important is research to what you do? And this was a question that was asked of specialists, and overwhelmingly they came back. And these are largely people that worked in traditional university academic settings. And they said, yes, it's very important. So it wasn't surprising with those results. And then we got a set of results that came back from the graduating fellows. So we asked the graduating fellows the same question. And we thought it would be really a diminution of what we'd heard from the leaders in the field. But we really overwhelmingly heard from the fellows that the research that they were doing in their fellowship was critically important to helping them understand the literature, but also moving the science in the subspecialty forward for the safety and well-being of the women that we take care of. But the most surprising thing that I think I have to share with you is that we have some data that's sort of hot off the press. And that is that we asked our subspecialty diplomates last year in their continuing certification application questions, how likely are you to do research? Or how likely are you to be doing research right now? And what we heard back really ubiquitously across the board from all of our subspecialists, 79.6% of them said that they were actively doing research or would be doing research in the future. And so that was, to me, a little bit surprising because you would think that people got away from fellowship, got in the community, that might not continue. But this is self-reported information. What do you think about that? Isn't it exciting?
Well, it's awesome, is what I would say. So, You first talked about sort of how the fellows view it. I'm actually really glad to hear that as well. I'm not surprised. Just working with fellows every single day. But 80% of subspecialists saying that they're either doing some research or planning on it is fantastic, because not all research needs to happen in an ivory tower. You can also make meaningful contributions, even if you're a doc in a practice, where you don't have tons of time. So I'm really happy to hear that. I think there's a recognition, that's from everyone, that's how we move our field forward. And that's how we take better care of women. So I'm a little bit surprised by that number. If I'm being honest with you, I thought it would be, a little bit lower than that, but close to 80% is just fantastic, and is, really a credit to our docs.
I'm going to shift gears and actually kind of go back to something we were talking about before. And that is that you talked about evidence and science being important in evidence. One of the things that is a discussion in the world right now is sort of what's the difference between science and a viewpoint, right? And we see that basically in our diplomates. Science informs how we do our exam processes. Science also informs the content of information on our exams, and we're focused on really evidence in order to create those questions and making sure that we're keeping up with the latest and greatest. But you hear in social media, especially, somebody has a different opinion or a different viewpoint, and it's a little bit different sort of for the mainstream thinking on that particular subject. I think it's really hard for even our diplomates sometimes, especially really for learners or candidates that are going to sit for our exam, to differentiate between what's science and evidence and what's somebody's viewpoint. So I was curious if you had some thoughts about how do we help our learners, and but also how do we help the public distinguish between what's a viewpoint and what's really evidence?
Yeah, I think especially your question is great, especially now with social media, when anybody can get out there on Instagram or Twitter or X, whatever it's called now, and literally post whatever they want, despite the fact that might be completely just their opinion and made up. So it is a problem, and you and I both practice clinically. Those patients who come in and say, "Hey, I read on Instagram X and Y, and should I be doing this or not?" And I always encourage people not to be reading things about their care on those sorts of sites. But to me, listen, everybody's entitled to their own opinion, and that's fine. But how do we sort of synthesize data so we can give people the best recommendations we can? And I think that's really where our professional organizations come in a big way. Whether that's a new practice bulletin from ACOG, or something from the SMFM Pubs Committee that I know really well, or from SGO or ASRM. They're the experts who are not trying to put forward an agenda, but rather are trying to look objectively at the evidence on whatever topic it might be, and to make a recommendation to both, our practicing docs, but also, patients have access to that as well. So that's where I always tell patients to look. And I've certainly printed off, opinions for people, not opinions, like a committee opinion from ACOG to read about, their condition and what the current set of recommendations are. And, I think we sort of saw it most recently with the Tylenol and autism, what recently happened. I think that's a good example of, that's an opinion. That's not evidence. It's not a fact, sort of what came out from the government. And that's an example, I think, of pushing an agenda rather than really looking at the evidence. So again, I always point our learners, our docs, and even patients to, again, professional organizations whose job it really is to sort of synthesize the existing data and to make recommendations. To me, that's the best form of evidence that we have.
The other thing that I think is important for our audience to know is that those entities also keep up that information, right? And so once there's a guideline or something that's published, they have a periodic review to say, okay, what's new in this particular subject? And as we gain more knowledge and more science, emerges so that there's new evidence, they're updating those documents on a really regular basis. And so those publications and documents, I think, are really go-to things that show us what sort of the standards are for our practice and what we want to get to. And I think the board has a real role in helping disseminate that information and getting it in the hands of the doctors that are right there taking care of patients every day.
Yeah, Amy, you're absolutely right. So those are updated, especially the ACOG documents that I know you've worked on those committees. I have as well. They are updated on a very frequent basis, not every 5 years, every year to every 2 years. And if there's something big that comes out, they get updated within a month. If there's like a really sentinel research study that sort of changes something of importance, and that gets publicized very widely. So you're right, they're living documents. They're not things that are written in 2026 and then not changed for 15 or 20 years. So I think that's a really important point.
So one of the things that we've been thinking about and working on here at the board is in this idea of with not the lowest bar, but how do you promote mastery, especially with continuing certification. We're trying to wrap our heads around how do we collate the latest evidence to make sure we're really getting that in front of our docs, because we really are in a unique position to get that information into the hands of the people that need it.
Yeah. And, I think that, at least from my perspective, so I do continuing certification, of course. And I'm always amazed that there's always like 3 or 4 articles in MFM that I didn't see that that the MFM division found. I'm like, wow, this is a really great article. I didn't see it in the British Medical Journal or, in Annals of Internal Medicine. And it is a really great way to make sure that you're keeping up. So, kudos to the teams that are in charge.
Thanks. Well, I'm so glad to have had you here today. This kind of winds up our podcast, but one of the things I always ask my guests for is if you had one parting thought you wanted to leave with our audience today about research or anything else or the board, what would that be?
Well, I think we talked about it. And to me, the way that we develop the best evidence to take care of our patients is through research. And it's fundamental to everything that we do. And I was really glad to hear that subspecialty information that you shared, but it's really important to sort of keep up with what's happening in terms of evidence. And I think the board can help with that as well as others, but it is critical to everything that we do.
So, George, thank you so much for being here. I know that our audience is going to love hearing from you and hearing on this topic about the value of research. So thanks again. And this is a wrap on our episode of Talking Women's Health. We look forward to seeing you next time. And you can pick us up on YouTube, Apple, and Spotify.